Welcome to today's health awareness video. This episode we will be discussing ovarian cancer, a serious and often silent disease affecting thousands of women every year. Ovarian cancer is known as the silent killer because of its early symptoms are not often easily noticeable, or I can say they are easily mistaken for illness or other serious condition. Understanding the risk factor, recognizing the signs and symptoms, and seeking timely medical help can save lives. Join us as I will be exploring or explaining the causes, symptoms, diagnosis, treatment option, and prevention of this condition that affect most women worldwide. So stay tuned. If you have not subscribe, like the video, share, comment. Don't forget to turn your notification bell so that every time I post a video you will be notified the first person. What is ovarian cancer? Ovarian cancer is a type of cancer that begins in the ovary, the female reproductive gland responsible for producing eggs and hormones like estrogen and progesterone. You already know the function of estrogen and progesterone. These are hormones that are also responsible during pregnancy, during menstrual cycle, during reproductive time. Yeah, there are several types of ovarian cancer. We have the epithelial tumor. It is the one which is the most common and affect 90% of women. Also, we have germ cell tumors. We have stromal tumor. Yeah, those three are the types of ovarian cancer that are available, or the research has shown us. So who is at risk of developing ovarian cancer? Women of 50 years and above. Female history of ovarian cancer, breast cancer, or any other cancer. Also, never have been pregnant. If you have never been pregnant, or you are planning not to get pregnant, you are at risk. Hormonal replacement therapy sometimes can put you at risk. Also endometriosis, and also history of cancer in your family. What are the common signs and symptoms of ovarian cancer? Abdominal bloating or swelling, pelvic or abdominal pain, frequent urination, difficulty in eating or feeling full frequently, fatigue and explain weight loss, changes in the menstrual cycle. These symptoms often persist and worsen over time. Sometimes the symptoms might be mistaken for another condition. Yeah, I think someone might be having maybe fibroid, and you mistake it with another condition. I think I think maybe you are getting what I'm trying to say. How can it be diagnosed? Pelvic exam is one of them. Doctors, nurses know how to do it. Ultrasound, those who have gone to school and done that, they know how to do it. Also biopsy and blood test. Early detection improves survival rates and significantly. But in many cases, many cases are diagnosed at advanced stage due to vague symptoms. So treatment option: surgery, where the ovary can be removed, the whole of it, or the uterus can also be removed. Chemotherapy to kill the cells, the cancer cells. Targeted therapy and hormonal therapy in some cases, radiotherapy, or you can use all those treatments. Treatment plan depend on the type, the stage, and the patient's overall health. Can it be prevented? There are no guaranteed prevention, but risk can be reduced. The risk factors can be reduced. Oral contraceptive, prolonged use or reduce the prolonged use of oral contraceptive. Pregnancy and breastfeeding. Yeah, pregnancy and breastfeeding. What am I trying to say? There are no guaranteed prevention, but risk can be reduced by oral contraceptive use, that is a long term. Pregnancy and breastfeeding, you get pregnant, you breastfeed. Yeah, yeah. And also for high risk women, you can remove the ovary, you can do the BTL. And yeah, if you experience persistent symptoms, those symptoms we have said for more than 2 weeks, especially if you are over 40, or you have a family history of any cancer, you should consider going to see the healthcare provider. Yeah. Any question about ovarian cancer? And most of these cancers, the cause is usually, or the risk factors are drug abuse, stress, age, family history, uh, what a woman not getting pregnant. Those are most of the risk factors. So you can work on those risk factors, what you can work on it. Some things that you cannot work on it, there is nothing you will do about it. You can only pray to God to help you not to get the disease. So I'm going to stop from there. Let's meet in the next video. Bye till next time.